Healthcare has a continuing epidemic of medical error, and that's a big problem for the industry, but that's a big problem for all of us as patients. Going back a decade and a half, early estimates from the Institute of Medicine said that there were 98,000 people dying every year from medical errors. I look to a non-obvious set of organizations, so-called high reliability organizations. So these are organizations like aircraft carrier flight decks, nuclear power control rooms, air traffic control towers. They operate complex technologies in really dynamic environments, and they do so in a nearly error-free fashion. And as I just noted, healthcare doesn't do it in a nearly error-free fashion. So what can we learn from these organizations? They have a set of behavioral processes that they engage in called mindful organizing. And mindful organizing consists of 5 components. And these are things you might want to think about if you're operating in one of these healthcare organizations. Preoccupation with failure, reluctance to simplify interpretations, and sensitivity to operations are 3 kind of proactive things people in these organizations do. Now, when things start to go awry, they also do a couple of things to contain errors. They are committed to resilience, so they treat near misses, close calls, and actual errors that break through as opportunities for learning rather than as opportunities to punish. They also defer to expertise rather than authority. So decisions get made based on the person with the most expertise with the problem at hand and not the person with the most formal authority in the hierarchy. And there are a couple of things that leaders in organizations can do to elicit these 5 components of mindful organizing. So leaders can implement what we call reliability enhancing work practices. One thing they can do is select people for interpersonal skills as well as their technical skills. Engaging in more mindful organizing means you're having higher quality conversations. You're thinking more broadly about your work. So people with interpersonal skills have more capacity to do that. Leaders can also implement practices around training their workforce in interpersonal skills. And what that helps do is build a shared language among the people they manage. And the last thing that leaders can do in terms of reliability enhancing work practices is empower their workforce. Give people discretion to make changes in their local context that actually enhance reliability. Those are the kind of habits that high reliability organizations have and that healthcare organizations would do well to emulate.